the main risk factors for stillbirth and other adverse outcomes is a failure of the baby to reach its growth potential. In fact, we now have good evidence that the majority of normally formed babies that are stillborn had intrauterine growth restriction. But in many instances, the lack of good growth of the baby has never been recognized during pregnancy, and this is something we need to improve upon. For mothers who have a low-risk pregnancy, we need to do serial measurements of fundal height, the size of the bump, with a tape measure. These measurements are then plotted on charts which are customized for the mother's characteristics which affect normal growth, such as her height, her weight, her ethnic origin, and the number of previous pregnancies. For mothers with pregnancies that are at increased risk, ultrasound scans at regular intervals in the third trimester are required to keep a closer eye on the baby. Together, these strategies have shown that firstly, they lead to better reassurance that the baby's growth is fine, but secondly, it has led to significant increases in detection when the baby's growth does not progress as expected. This growth assessment program has already resulted in a drop in the national stillbirth rates in England to their lowest ever levels.
The Perinatal Institute Growth Assessment Programme, or GAP, is based on three main elements. Firstly, the training and accreditation of all staff involved in clinical care, standardised fundal height measurement, and the introduction of customised growth charts. Secondly, we have evidence-based protocols and guidelines. And thirdly, a rolling programme of audit and benchmarking of performance, including monitoring of IUGR detection rates and regular audit of missed cases to help identify system failures so that lessons can be learned and changes can be implemented to improve care for future pregnancies.